morning, everyone. Welcome to the second annual Black Mental Health Roundtable. For those of you joining us in person here in DC, thank you for sharing space with us, and we respectfully ask you to find your seats. If you haven't silenced your phones yet, please make sure they're on silent. We appreciate that. Thank you. For those turning in remotely, we appreciate you giving us your time and attention this morning. As the first to welcome you to today's roundtable, let me start by introducing myself. My name is Chris Langelotti, and I serve as the research director at Hurdle Health. For the past 7 years, I've worked closely with Kevin Dedner, the founder and CEO of this event's principal host, Hurdle Health. I've worked with him throughout his professional and oftentimes personal journey to uncover links between racism and mental health. I'm honored to call him my mentor, my boss, and most honored to call him my friend. Hurdle exists because Kevin chose to live his life out loud. He chose to share his personal experience and personal journey with depression. In particular, he shared his challenges in finding therapy that honored his culture and race. Over the years, he shared all this in hopes that his journey out of depression, his healing, could be an experience replicated for other Black people, and over time replicated for other communities who have been historically underserved and misserved in America's mental health care system. Hurdle's work to uplift these communities requires a systems approach, one that dismantles structural racism and entrenched stigmas. That is why our vision is multidimensional. It is a vision in which several health moonshots are achieved. Better mental health for Black, Indigenous, people of color, yes, but by way of knocking down the invisible barriers to care, by bridging access to care gaps for these communities, and ultimately through the destigmatization of mental health. This kind of systems approach requires collaboration. It requires intentional spaces to collectively deepen our understanding of what's needed to heal the minds of the oppressed. So on behalf of Hurdle, and in collaboration with the Kennedy Satcher Center for Mental Health Equity, the National Alliance on Mental Illness, the American Psychological Association, and our host, U.S. Representative Sheila McCormack, we are all honored to be here for this important work, and thank you for being here with us. We are gathered today in commemoration of the second anniversary of George Floyd's death. We are gathered to honor his life and his legacy. We honor him through a collective, intentional discourse on racism and mental health. Within a week of Floyd's death, anxiety and depression among Black Americans shot to higher rates than experienced by any other racial or ethnic group. According to the 2020 data from the U.S. Census Bureau, 41% of Black Americans screened positive for at least one of these symptoms. The data is alarming. However, it is not surprising to those who have experienced the well of darkness after incidents of anti-Black violence like Floyd's death. But it is an experience that is often lived in silence. Today, we break that silence. Today, you'll hear from some of the leading clinical researchers and mental health advocates who have established the empirical evidence of racism's impact on mental health. Pulling from Hurdle's report titled Voices of a Collective Experience, they'll unpack how prejudice and oppression surface through indirect or vicarious racism. Maya Angelou wrote, "There is no greater agony than bearing an untold story inside of you. That is why we say his name, George Perry Floyd Jr. That is why today we share the story of Floyd's death, but also his life. That is why today we share Darnella Frazier's story, the 17-year-old who had the courage to record Floyd's death on her cell phone on May 25th, 2020. And it is why we lift up the voices of others who have carried their stories of direct and vicarious racism inside of them for far too long." And now, to guide us through our roundtable agenda and panel discussion, it's my honor to introduce you to today's moderator, Dan Gillison Jr., Chief Executive Officer of the National Alliance on Mental Illness. Dan's expertise and leadership in mental health advocacy is far-reaching. In addition to his nonprofit leadership and passion for advocating for people with mental illness at NAMI, he spearheaded the creation of the CEO Alliance for Mental Health in 2020. With Dan's guidance, the Alliance has collaborated to amplify its priorities for creating a future of quality mental health care for all who need it. Dan, thank you for moderating today's event. I will turn it over to you.
Good morning, everyone, and it's a pleasure to be here. And thank you very much, Chris. I really do appreciate that introduction. To our audience that is watching on Zoom, we appreciate you. And I'm going to start with the end in mind, because we know that everyone won't be able to stay with us just because of other things that you're challenged to do on your busy calendars. So what I want to ask you is make sure you tell your friends about this event for next year. And let's spread the word, and let's work on the collaboration and building the coalition to make sure that we continue to bring even more voices to this venue. It's a very important venue, and we need our voices and your voices. And for all of us that are here, please tell 2 to 3 other people, okay? Thank you very much. And let me go ahead and begin by saying thank you to Hurdle and the Kennedy Satcher Center for Mental Health Equity, the American Psychological Association, and U.S. Representative Sheila Mccormack, thank you, for providing a shining example of collaboration around issues of mental health equity. Before we begin the Q&A, we have the pleasure of hearing from our collaborators, and as well as our host, Congresswoman Mccormack. The Congresswoman proudly serves Florida's 20th Congressional District and joins us today as a part of her legacy of advocacy for equitable health care. She is a wife, mom, executive, and advocate for the people. She is also a trailblazer as the first Haitian American from Florida sent to Congress and the first woman to represent her district. As the daughter of immigrants, she has experienced the American dream, but it has not been without hard work or hardships. Over 10 years ago, she began advocating in Washington, D.C. on Capitol Hill to drive positive change in healthcare reform. Her success and expertise as a chief executive officer of a healthcare company opened many doors, including sitting down with many members of the United States House of Representatives and the United States Senate. With every door that opened, she took each opportunity to advocate for children with disabilities, healthcare expansion, and economic development. Please join me in welcoming Congresswoman Sheila Mccormack.
I'm a little vertically challenged, so I have to tilt it after coming behind you. But thank you so much for being here this morning. This work has been a work that's been in progress for years. And it's exciting to be here today with each and every one of you in person and online, where we're taking actually affirmative steps to start hitting the mark. And the mark has always been for economic and healthcare equality. They're partnered together because no matter how far we get economically, if your mental state is not there, you can never prosper. We see that so many people who are existing today spend so much time on addiction and not actually pursuing the treatment that they need. So all of us coming today is such an excellent opportunity for us to start the needed work that we all have noticed has been necessary. I want to start off by saying a special thank you today for the founder of Hurdle, a beautiful report you guys put together, also the Kennedy Center and NAMI. It's an excellent opportunity for us to be here today and talk about what's going on. I could tell you my background in healthcare for the last 20 years. It seems like I've known healthcare my whole life. I've been in home health where we actually dealt with the physical body. But I realized very quickly that the physical body without the mental health equates nothing. All the social determinants that block you from actually having physical health is actually exacerbated when it comes to mental health. One of the biggest reasons we notice that is not just economic, but cultural competency. The trauma of being African American and living in this country. The trauma of even being an immigrant and now being joined into the African American experience and experience systematic racism. Being targeted, the entire family system is affected. We see that mothers are worried about their children continuously. And what really happened during George Floyd for our entire nation is for the first time, they got to experience what we've been experiencing our entire life. The injustices that come by just being Black in America. We've seen this before in our personal families, but this is the first time we had to relive it constantly on social media, on TV, in the news. It was traumatizing for all of us. We keep revisiting our trauma as we watch different shows that talk about slavery, or even people who try to ignore the existence. As we talk more about this critical race theory, trying to deny the truth of what was done, the abuses, the mental and physical abuses, the trauma that still lives in us today, us being afraid to exist and tell our story. Being a representative from the South is a different fight. In many spaces, we cannot talk about our trauma. We can't talk about it in the work field. We can't talk about it in schools. We can't talk about it amongst other parents because everyone wants to act like it didn't exist. And so this is why it's so crucial that the healthcare community, that these organizations are coming together today to actually right the wrongs and find a pathway to equitable access to mental health. So I thank all the clinicians who will be speaking today, all the organizations that are coming together. And I know sometimes when you're going into this venue, because it's a new area actually, we hit a lot of walls, we get frustrated, put so much into it, and you don't see the results that you're looking for. Stay on course. This is our destiny work. Our generation will be known for this, where it's no longer a stigma, where we build trust into the Black community to go see a therapist, that they feel comfortable to express their true feelings of what's been holding them behind, what's been drawing them to addiction, where they have a safe space where they could be respected and dignity can be restored, because that's what we're doing with mental health. We're restoring the dignity of every African American and Black person living in our country. There's a few facts that alarm me every day when I read it, and I want to bring it to your attention, which I'm sure a lot of you already know. Historically, adversity, which includes slavery, sharecropping, and race-based exclusion from healthcare, education, social and economic resources, translate into socioeconomic disparities experienced by Black and African American people today. Socioeconomic status, in turn, is linked to mental health. People who are impoverished, homeless, incarcerated, or have substance use problem are at higher risk for poor mental health. 16%, which is actually 4.8 million of Black and African American people reported having mental illness, and 22.4% of those 1.1 million people reported a serious mental illness over the past year, which means that not only are we dealing with our historical trauma of living in the United States, but now we have an extra compounded layer of COVID. Not having access to healthcare during COVID, suffering through and trying to figure out how you protect yourself during COVID. For many African Americans, our first line of refuge has always been the church. During COVID, we couldn't even go to the churches. So where did we get our help? All these are compounded in our day and time right now. Because less than 2% of American Psychologists Association members are Black or African American, some may worry that mental health care practitioners are not culturally competent enough to treat their specific issues. In my 20 years, that has been the number one reason why we could not get African American families to seek help when it came to mental health, addiction, recovery, and even transitioning from incarceration. The lack of trust. So now we must come together and build that lack of trust. Nearly 90% of Black and African American people over the age of 12 with substance use disorder did not receive treatment. This is what we're facing. And you guys are the brave people who join us today, charting the path to right the wrongs, charting the path to make sure that everyone has access to mental health, and only then will we truly see our country live up to its great capabilities, where everyone can actually have the real opportunity to be successful and to have a family unit. And so I thank everyone today. I thank you for all the hard work that you have been doing and pursuing. And I look forward to working with you closely in the future as we chart out this path to make sure that we have equity for everyone when it comes to mental health. Thank you for your work.
Congresswoman, thank you. I know you have to go, but I want to just say this as you leave. This is about leadership, tone, and execution. We appreciate you and what you're doing. So thank you. Have a wonderful day. All right, okay. Next, I'd like to introduce former Congressman and co-founder of the Kennedy Satcher Center for Mental Health Equity, Patrick J. Kennedy, along with Mesa Akbar, Chief Diversity Officer of the American Psychological Association. Patrick has dedicated his life to improving the care, treatment, and public policies and understanding surrounding the issues of mental health and addiction in the United States and around the world. During his 16 years in the U.S. House of Representatives, serving Rhode Island's 1st Congressional District, Patrick J. Kennedy fought to end discrimination against those with mental illness, addiction, and other brain diseases. He is best known as the lead sponsor of the landmark Mental Health Parity and Addiction Equity Act, federal parity law, which was passed with bipartisan support and signed into law on October 3rd of 2008. Amid countless recognitions, meaningful partnerships, and political affiliations, Kennedy's most important achievement continues to be leveraging his family legacy in the arenas of civil rights, mental health, and intellectual disabilities to advance the cause of social justice and health equity for all people. As I bring Patrick up here, Patrick has become a friend, an ally, and a mentor of mine, and he and I get a little animated when we talk about workforce development and some other things in terms of the passion of what's needed in this space. But what I would tell you is that, as I said for the Congresswoman, and I'll say it here, it's about leadership, tone, and execution. And people don't care how much you know until you know how much you care. He knows a lot, but he cares even more. Patrick.
Thank you, Dan Gillison, head of NAMI. And I see Schroeder Stribling from Mental Health America. This is being supported by the leadership in the mental health community. So honored that Arthur Evans, the American Psychological Association, has been a champion of this forum. And finally, let me thank Kevin Dedner and the whole team at Hurdle for really taking this on. So Dan said that I've spent my life leveraging my family connections. And I have to say, you know, when I first got elected at the age of 21, and then got elected to the Congress at the age of 27 as the youngest member of Congress. And then I was elected to leadership in the House of Representatives at age 31. I just want you all to know that none of it had to do with my last name being Kennedy whatsoever. It was all my good looks and personality, Dan. That's what did it. So, you know, I had a lot of built-in advantages. You know, I had this last name that, as they say, you know, was born already on third base. You know, I already had the advantages that, you know, anyone can ever dream of. But I was also fortunate. I grew up in a family that was guided by faith. And the belief is that we owed it to each other to treat each other with dignity and respect. And when my dad passed away, on his mass card was Matthew 25. Those are there for at least one of these. My brothers and sisters is there for me. It's the only place in the Bible that talks about entrance into heaven. It's if you want to get into heaven, you just have to be there for the person that is in most need and most marginalized. And so when I took up my service in Congress, you know, it was clear to me from my own family experience that people with mental illness and addiction were really judged and stigmatized and discriminated against. Now, this didn't matter whether you were black or white. You just were, you know, held to a different standard because people always felt that there was a reflection of a moral failing rather than a medical failing. And it was hard for me to overcome that stigma in my own life because I was taught to be quiet, not to talk about it, to be silent. But, you know, as I was growing up, I remember the big rallies here on HIV/AIDS, and the banner was silence equals death. If you were quiet about it, guess what? The pandemic of HIV/AIDS would go unabated. But if you spoke up and you fought back, then we could address it because we'd be able to get the policy changes to finally acknowledge this deadly killer. And I can't help but think that today with mental health, silence equals death. We have the highest suicide rates, highest overdose rates, highest incidences of anxiety, depression, and disability due to mental illness and addiction. And what's the response? Yes, we have made some recent moves to try to address this crisis, but nowhere commensurate with the demand that it deserves in terms of our response as a nation. Our response has been anemic. Our budgets are anemic. They're a fraction of what we would spend if this were any other physical illness. Let's just be honest. That's the way it is. And frankly, it's a reason that this happens is people aren't willing to stand up and be counted and say, yes, I too have a mental illness and addiction. And I thank Kevin for his personal leadership, in addition to his entrepreneurial leadership in setting up Hurdle to try to address the double inequity, not just against people who suffer from mental illness, but people of color who suffer from mental illness and have the double stigma of being on the outer margins of those who are marginalized. I have been studying mental health and better interventions my whole life. I've done it when I was a member of Congress. I've done it kind of as a person on a personal journey through the mental health system in our country. And I can tell you that nothing matters as much as one's ability to be heard, to be identified with, to have connection with. I am in recovery today from addiction to drugs and alcohol. I find my recovery in the stories of others that can identify with my lived experience. And when you put us all in the room, we all first identify ourselves as people in recovery from addiction. We have a way of developing a relationship built upon common experience. Unfortunately, in this country, for people of color who are struggling to get better from mental illness, you do not have a therapeutic community that reflects the needs of a big percentage of our country. And when you have a report like is being presented today, you realize that part of what this system needs is it needs enough providers that actually look like the communities that they are providing care for. Now, I have no idea what it's like to have different colored skin and walk through life and be subject to the judgments upon me simply because of the color of my skin. I have no idea, as Kevin writes in his book, what it's like to be a father and worry about my child getting taken aside because the store clerk thinks that he stole something from the store just because of racial recognition and bias. I have no idea what it's like to be Dan Gillison as a father and have to clear out my closet of hoodies because I can't stand the thought that my son is going to be put in jeopardy as a black man when he's also wearing a hoodie. I have no idea what that's like. But I do know from my family's faith teachings that I have an obligation as a white person to try to walk in those shoes. I could never do it, but I could at least try to have empathy or understanding at some level. And I am so honored when I'm ever introduced to be the nephew of the first president to go on national television and speak about the immorality of our country's reckoning with race relations. President Kennedy took a while before he came to the podium as the first president to address civil rights, but he did it. And he did it because he was watching the television like everyone else during the great protests in the early 60s around civil rights. And he was appalled, not as a white man, appalled as a human being that any human being would be subject to the kind of assaults that we saw in the early civil rights battles. And he decided that moment, out of human reaction, against the better judgment of his political advisors who said, wait, as Dr. King said in his letter from a Birmingham jail, now is not the time. He instead went on national television and introduced a civil rights bill because he said in his national address, who amongst us would be willing to trade the color of their skin and be content with those who counsel patience and delay? In other words, if you think we're going too fast on civil rights, try changing places and seeing how you would like to be told to wait longer for justice that is easily accepted if you are a white person, but is never accepted if you're a black person. And I think that golden rule, treat others as you would like to be treated, is the moral compass that should guide this debate about whether we as a nation do what we need to do to repair the disparities in the access to mental health, which exacerbate the real disparities in suffering from untreated mental illness. And then, of course, you've got this report today that talks about what it is like to live as a person of color in the wake of George Floyd and all of the other George Floyds, the modern-day Emmett Tills, who have to witness and relive every police video of every shooting, of every crisis over and over, and have that strike at your own trauma and lived experience. I have no way of understanding it except to say that I had to grow up in my family watching black and white reels over and over and over of the assassinations of my uncles, and I know that it impacted everyone in my family. And the fact that you had to relive it every year, every anniversary, it is unimaginable to me as a black person in America what it's like every night to go on and watch the news and have to see black people, systematically discriminated against and often murdered simply because of the color of their skin, and then be able to live your life as if nothing's going on. Because that denial is what kills you inside when you're someone who is not reckoning with what's happening inside of you. And then you can't get help because no one that you can go see has any inkling about what it is to live that experience. So the hope that I have for this report is that we as a nation, when we build this pipeline of new therapists, which is now being discussed right now on the Hill. In fact, we're going over to Chairman Wyden's office afterwards. His number one issue is how do we build a pipeline to meet the needs of our country, that this report is going to help make sure that a good percentage of that new pipeline has to be people of color, such that we can have a therapeutic response to our countrymen who experience this vicarious trauma on a repeated basis and need therapists that look like them to help them through it. So I thank you all for being here today, and those who are online. I want to thank Dr. David Satcher, who is joining with me at the Kennedy Satcher Center at Morehouse School of Medicine to put a spotlight on other forms of systemic discrimination, particularly around our justice-involved populations, and how do we reform that system of justice that frankly incarcerates more people in America than any other free industrialized nation in the world. Imagine we're a free country, and yet we incarcerate and put people in prison more than any other industrialized nation in the world. And unfortunately, an overwhelming percentage of those people are people of color. So we're trying to address the systemic discrimination in our justice system, but if we don't address the mental health system, as we know well, unfortunately more people are going to be caught up in the criminal justice system, because that's nothing but a default, really, for a lack of a sound public mental health system. And with that, I turn it back to my good friend, Dan Gillison.
So Patrick is not passionate at all. Patrick, as you started this, you mentioned Book of Matthew and that the Mass card. And I'd also offer to you in the Book of Matthew the parable of talents. And the parable of talents, you're bringing all your talents to this, and we appreciate you doing that. As I hope I have this mic up where the audience can hear fine. I'm getting a thumbs up, so my apologies for not having the audio where you needed to hear. I'd like to now introduce Dr. Akbar, but before I do that, mention the parable of talents. I want to stay on this message about leadership, tone, and execution. What all of the leaders will be talking about today is taking action and executing. And Patrick and the Congresswoman are setting the stage for us. And it also is about research. It is about data and how data influences and drives what we can do and messages that. So let me now move to Dr. Akbar as a respected scientist practitioner and the APA's Chief Diversity Officer, charged with infusing equity, diversity, and inclusion into the fabric of the association's work. Before assuming the CDO post, she was the founder and chief executive officer of a clinical practice based in New Haven, Connecticut, that specialized in race-based trauma. She also created a consulting firm and educational network focused on organizational cultural transformation. Based on Akbar's experience in EDI, she was selected to serve as an APA representative at the United Nations, providing research and guidance toward the development and implementation of psychologically informed policies that respect human rights and promote human welfare. Dr. Akbar.
Thank you kindly for that introduction. And difficult to come after such an incredible presenter, but I'm moved and motivated by your words. And the one thing that I thought about as you were speaking was the legacy that we're here to create, the new legacy and the new opportunities that we have that we don't need to carry on, but that we can break destructive cycles of violence and oppression and racism and build a new world that looks very different. I'll begin with legacy, but I'll also end with legacy. It's an honor to be here representing the American Psychological Association, and it's especially important to talk about this topic of Black mental health. I want to thank Hurdle for elevating this conversation. It's such an important and critical topic, and I want to thank Dan Gillison from NAMI for the wonderful introduction. I'm here today to amplify this conversation around the impact of racism and mental health. And there are several things that I need for you to leave with today. First, I want you to know, what is the impact of witnessing or being a bystander during racially motivated incident? What happens to you when you're watching it, when you're seeing it, not just when you're experiencing it? What we do know is witnessing discrimination against one's own group can lead to incredible psychological distress. It can affect our self-esteem and a host of other mental health issues. We also know that systemic violence and the threat of violence, especially over long periods of time, can have and generate adverse effects across generations, not just once, not just twice, not just 3 times, but across many generations that we carry even in our DNA. Trauma is typically characterized at the individual level response, but there's a growing body of research that tells us that it actually impacts entire communities, right? When you're living through those traumatic events. And we also know that prolonged exposure to violent conflict can impact many generations to come, even the unborn generations that we don't know of yet. In this way, individuals who are not personally exposed to traumatic events can still experience traumatic symptoms. And even if they're not in contact with the traumatic experience, they can still be part of a society that experiences these events every single day and not know what to do, how to identify, or how to categorize their trauma in a way that is palatable or understandable. APA's 2021 Stress in America report found that Black Americans were most likely to report discrimination as the primary stressor in their lives. And this, we have seen a pattern of increase year over year over year. So it's not reducing, it's increasing. The second area that I want you to leave here with an understanding is the impact of what discrimination does to the people in which it affects. And it creates a phenomenon that you've heard the Congresswoman and many talk about related to race-based trauma or racial trauma. According to scholars who study the psychological underpinnings of racism, when Black, Indigenous, and people of color experience racism, discrimination, or even microaggressions, let's not leave those out, whether personally, vicariously, or collectively, it affects both their mental and physical health. We've heard that multiple times today. The outcome, however, of these experiences lead to what we have now coined as racial trauma. And whether these experiences or these threats present themselves in the form of harm and actual injury, or whether they express themselves in humiliating or shaming events, or when they present themselves by you witnessing the racial discrimination directly, it all impacts the way in which we live, we work, we play. Racial trauma is defined as a cumulative effect of racism and has been linked to anxiety, depression, and suicidal ideation, and a host of other physical issues like high blood pressure and obesity. Racial trauma continues to be chronic and pervasive in most communities. That is why it is not post-traumatic stress disorder. It is current, it continues. Based on the racial trauma approach, the question we should be asking is not what's wrong with you, but instead is what happened to you. Little ways in which a person's dignity is chipped away predict poor mental health outcomes and a host of physical problems. In fact, we can officially say that racism itself is a killer. The lens of racial trauma allows us to humanize the experience of Black Americans and consider the intersectional lenses. The third area that I want you to leave with is that we have to build a legacy for the future that's anchored in resiliency. At the individual level, these are the thoughts that I'll leave. It is expected that people feel stressed, angry, outraged, and frustrated, and a host of different other feelings because of the systemic problem. Acknowledging those feelings, do what you can to take care of yourself, and continue to cope even in today's reality. Try to participate in culturally affirming activities because they fill you. Continue to share, even if social gatherings because of COVID are not possible. These activities will help you to stay connected to your community and anchor you. As much as possible, try to limit your exposure to media because we know, and this is a conversation today, what vicarious racism does to us. It harasses us, it assaults us, it harms us. For many people of color, watching these videos can trigger a trauma response and many negative emotions. But this is particularly true for our young people, which we have to take care of. At the collective level, and my final parting words, and how we anchor ourselves in a new legacy, is that collective trauma requires a collective solution. Regardless of your individual identity, there is one important element that we all share. We are all humans. We are all wired for connection. And most of us aspire to live in harmony with one another, wanting to protect our families and create a better world for our children. For that reason, we all have a collective responsibility to create a future that is anchored in our humanity, seeing each other as equals, coexisting in a society that is inclusive, that is just, that is fair, and where we all believe that we can create a new legacy together. Stand today as we build tomorrow's future. Thank you so much for having me here.
Dr. Akbar, thank you very much. You left us with some really good things to think about. Not what's wrong with you, but what happened to you. That's one. Not what's wrong with you, what happened to you. And then also collective trauma, collective solutions, collective responsibility. So thank you. Community is very important. And as we move on, data is critically important in your research, and what you've been able to help us with leads us to our next area, and this is to look at the research report and talk about the research report. So with that said, I'd like to introduce the research team. They're going to be coming up on the dais here in just a moment. Dr. Ashley White-Jones serves as a research advisor for Hurdle Health and is a co-founder of the company. Additionally, she is a postdoctoral research associate at the University of Mississippi. Her academic research agenda focuses on health equity and disparities in the Black community. Her current research explores culturally responsive mental health teletherapy for Black and other minority communities. Among her other pursuits, she is working to create a curriculum for nursing and public health students centered on Black maternal health. Dr. Ashley White-Jones. Next is Dr. Harold Woody Neighbors. Dr. Neighbors is an applied social psychologist with a background in survey research. He specializes in difficult-to-reach populations, such as prison residents, psychiatric inpatients, low-income groups of color, and men. He has spent his career studying racial, ethnic, and gender disparities in health-seeking behavior for emotional problems and the measurement of mental health in treatment and community settings. He is currently researching how to modify structural determinants so that individual health behaviors are easier to implement. Dr. Neighbors. Now, Dr. Norma L. Day Vines serves as Associate Dean for Diversity and Faculty Development in the School of Education at Johns Hopkins University and maintains a faculty appointment as Professor of Counseling and Educational Studies. Her research agenda examines multiculturalism as an indispensable tool in the delivery of culturally competent counseling and educational services for clients and students from marginalized groups. Dr. Norma L. Day Vines. So as we look at the first question, and I guess I'm supposed to come up on the podium with you, and it's safer over here, but I'll come up there. So let me do that now. I hope the audience is still with us online. Everybody good? All right, let's get into the questions here. Data and research is critically important as we look at the first question. The first question is really looking at this being our second roundtable on Black mental health, and it's held in commemoration of George Floyd's murder. Last year, the roundtable and the accompanying report focused on the state of Black mental health and in particular racism's impact on it. This year, the focus is on vicarious racism. Dr. Neighbors, what is the difference between racism and vicarious racism?
Yeah, excellent question. Before I respond to that, I wanted to just make a few brief comments. First of all, I want to thank everybody for coming out today, and I want to thank particularly Hurdle for putting this together. I'm very excited to be here and honored to be here. I did want to let you all know that today I'm going to be approaching this issue as a public health person. I'm a psychologist by training, but I spent most of my career in the School of Public Health. And I want you to know that because if you're public health, then you're very interested in prevention. You want to get out in front of the problems that we're going to talk about today. And so when I think about public health prevention, I think about social determinants, but I've stopped calling them social determinants because they're even broader than that. They're actually, I like to call them socio-political determinants. And when I look at the socio-political determinants that affect Black mental health, it says it right there. The most fundamental socio-political determinant that affects our health and our mental health is racism. Now, having said all that about prevention, I understand that we have a long way to go before we are going to eradicate racism, systemic racism, vicarious racism, which means that many of us will be hurt. There will be the inevitable casualties of racism. And so that's why I stand with Hurdle, because we really need to increase access to mental health services, because we know many of us are going to be in pain as a result of the socio-political determinants of mental health. So to get to your question, I'm going to take the first part, and then I'm going to kick it over to Ashley to my left. I think about racism very simply as a socio-political and economic strategy of exploitation that was willfully put together in our country in order to benefit some and to disadvantage others. So the way I think about racism is that if it weren't for racism, there would have been no need to invent races. In our country, if you have racial groups and you're thinking about racism, then you understand there's a hierarchy. Certain groups are at the top, some at the middle, some at the bottom. In my experience as a black man, it seems like black people have always been placed at the bottom of that hierarchy, and white people have placed themselves at the top. And so sometimes we have to say white supremacy when we're talking about racism. So let me close by saying if I mention white supremacy and racism, I am not calling anybody a racist. I'm talking about a system that has had a long reach over many years and is still affecting us today. So at that, I'll turn it over to Ashley.
Awesome. Thank you. Good morning to all of you. I'm excited to be here and to join my distinguished colleagues, actually see them in person for the first time, and to talk about this very important issue. So as we were thinking about what we wanted to share for this second roundtable discussion, we kind of started to survey the scene and think about those who were there, who were watching George Floyd literally die in front of them. And so we thought a little deeply about what that experience must have been like to be a bystander, to be the person who's not being directed towards racism, but actually still witnessing it, watching it happen, and reeling from that effect. And so that's the approach that we took this year for this report. And we also wanted to kind of highlight the fact that even though George Floyd's family does not have him anymore, they are forever changed. Those individuals who were standing right there outside the Cup Foods grocery, their lives have been changed as well. And so it's important for us to honor them as well, which is why we chose to kind of look at it from Darnella Frazier's perspective and how we got into this conversation of what it means to be a bystander. And so when we talk about the differences between racism and vicarious racism, one of the easy ways to think about it is secondhand smoke. So you're not the person that's smoking, but you might be in a room with a person that's smoking, and you're still going to be at risk for lung cancer, the same way that vicarious racism is impacting the Black community. I may not have been there to witness it, but I watched it, and I had the same feelings. That trauma, it doesn't escape me because I'm watching it on my cell phone. It doesn't escape me because I'm looking at it in bed on my computer. It doesn't escape me because I wasn't there. Collectively, we all bear the same pain, the same feelings. And our report this year is a little different because we as a research team, we decided to actually do our own study and to talk with individuals who have these particular experiences. And so our research kind of looked at 4 focus groups, and we have stories from about 22 individuals about their experiences with vicarious racism. And some of the key themes that came out of this particular report from those participants is that witnessing racism feels the same, as if witnessing vicarious racism feels the same or worse than being the actual recipient of direct racism. And some of them really felt that it was so tough because they lose all of their agency to intervene when you're watching it from behind the screen. And so you can't jump in, you can't take the brunt of it for somebody, you can't redirect anything because you're watching it happen. They also mentioned how there's a collective pain, and I've been hearing that word mentioned over and over again today about the collectiveness of this particular issue. Is that when they experience this, they feel anger, they feel anxiety, they lose sleep. And a lot of us who have watched the videos or who have tried not to watch these videos, we all feel those same emotions over and over again as we be introduced to a new person, whether it's Patrick Loyal, we think about Kajami Powell, we think about Alton Sterling, Fidel Castillo, all of those individuals, we watched them over and over again. And then the third thing that we kind of found from our research was that a lot of this is directly tied to our identity and tied to how we feel as a Black body. And so that pretty much gives some of the highlights of the research that we were able to find, and those things are also included in our report. Thank you.
Thank you very much, Ashley. Very good. In the report, you will read that Darnella Frazier, she not only the 17-year-old, but she had the mind set to tell her 9-year-old cousin to go in the store. She felt something, and so she wanted to shade her young cousin from what she was looking at, or what she thought she was going to be looking at. So there is the vicarious trauma in what that was there, and there's more to it in the report. It's extremely well done. So we really hope that all of you will read that report. But Darnella Frazier is impacted the rest of her life, and thank you, Ashley. Dr. Dave Vines, and can you unpack what mental health equity and parity mean, and what a future might look like where this is achieved?
So, in the report, we talked about parity. One of the things we think about is the notion that when there's reimbursement for physical health, it's not the same as mental health. Mental health is reimbursed at a much lower rate, and that's a problem that discourages people from getting care. Sometimes it discourages therapists from, the kinds of clients that they will agree to see. And so we think that there should be parity between the way reimbursement occurs for physical and mental health.
Thank you. And also the administrative task in terms of the medical professionals filling out the paperwork. It's much more intense for mental reimbursement than it is for physical reimbursement. If I tear up my knee and I need to have an orthopedic surgeon, that paperwork looks very different for reimbursement than the paperwork and what needs to be completed for a mental health examination. So just for reimbursement. So thank you very much. Let's get to this next question. And according to the American Psychological Association's 2022, and Ashley, I'm going to come to you on this one, 22 Stress in America poll, 87% of adults agreed it feels like there has been a constant stream of crisis over the last 2 years. Parallel to that statistic, we know that this feeling has been most pronounced in Black and brown communities. Communities that have experienced the sharpest increase in rates of depression, stress, anxiety, and I would also say hopelessness. How do vicarious racism and trauma play into these increased rates of mental illness in these communities, particularly in these last 2 years?
So it's interesting as we talk about what has kind of happened to us in these last 2 years. Not only have we been dealing with a pandemic, but we've been dealing with the racial justice epidemic here in our nation. And so one of the things that COVID highlighted for us is that Black people have been experiencing these things for far too long. Whatever happens, whether it's heart disease, whether it is diabetes, Black people are at higher risk because of the racism that we have experienced. And so COVID kind of, as I'm from the South, so I might use some Southern Southern terms, but COVID really was the straw that broke the camel's back when it came to exposing the health disparities that Black people were faced with. It really just kind of opened it up. And sometimes I think about it from this perspective is that even though we were out here supposed to be socially distancing, wearing masks, Black people were still being killed by the police. So none of that stuff stopped happening, even though the world kind of stood still for a moment. But none of those things stood still for Black people. And so within this time frame, we are dealing with, the mental health issues from just being a part of living through a pandemic, but also thinking about the excessive things that you see on social media, being reminded that, you're still Black in this particular space, and all of those mental health issues compounded with the effects of COVID, the isolation, the loss in jobs, the just the enormous amount of pain that people are feeling. And so, what we kind of noticed also within our report through Hurdle was people kind of talked about the feelings of grief, the feelings of anger. We also saw that there were more poor mental health days for individuals who had experienced it. And when we think about over the lifespan of Black Americans, COVID for the first time has actually decreased our life expectancy. And so where we were pretty much on average to live about around 76, 77 years, COVID is about to shave off about 10 years of our life expectancy because of all the things that we've dealt with over these last 2 years. And so we see things like loss of sleep, anxiety, those all play into people's mental health. We also see just not being able to verbalize it and talk about these issues. It's always, I'm fine. And particularly in the Black community, we talk about resilience as a good thing, but resilience is also harmful for us because we've been kind of conditioned to keep all these things inside and to just keep pushing on because nobody wants to hear about what Black people have to go through. But we're here today to talk about, in particular, what we're going through and to find those solutions.
Yeah, thank you very much. And you hear the, oh, here we go again kind of a thing. So to that point, thank you. And that's why it's so important that we continue this conversation. And as we talk about it, and Kevin, thank you to you and Hurdle for this. Let's and we talk about, thank you so very much. There's strength in vulnerability. And in Kevin sharing his story and building Hurdle, he's sharing his story and his vulnerability to make us stronger. But it will take our collective voices. Just as a sidebar, because Kevin did tell me, Dan, we want you to also have a voice for NAMI here. We have a site called Hearts and Minds. So when you go to our website, go to Hearts and Minds, and it really does talk about and it shows the impact of the mental or the physical on the mental, the physical on the mental. There is no physical health without mental health. So just wanted to say that. And also as we talk about as we're getting ready to go into the graphic videos, I also want to mention Christian Cooper, Central Park. And I'll ask you all a question. The power's in the question. The power's in the question, not the answer. So what I want to say to you all is, what would have happened if Christian Cooper had not had his technology to video capture that situation with the dog walker? The police would have shown up based off of her call, thinking that he had done something to her, but he had the video. What if he had not had that? That gets into trauma. Let's go to the next question here. And I brought that up because the question here, as I set it up, is this. Some argue that it takes graphic videos going viral before issues of police brutality and anti-Black violence are given any attention. Yet witnessing the videos is emotionally and mentally traumatizing and results in vicarious racism and trauma. And this is for everyone on the panel. Can you share your thoughts on this paradox? And how should we address this afflictive paradox? Who'd like to go first?
Yeah, I'll take a stab at that one. It is a paradox. Before I do though, I wanted something that Dr. Devine said about parity. I just wanted to just give a brief anecdote. Because today I really feel like speaking more from the voice as a Black man. Of course, I've done all this research, and I went to school. I got some degrees, but that's not all of who I am. So let me just say one story about the way I think about parity. And something that just bugs me, rubs me the wrong way. You hear people talk about behavioral health and physical health as if behavior is not connected to everything we do. Now, I understand why we have this bifurcation of mental and physical health, but I think everybody in this room understands the body is one system. So if you take me, for example, I have type 2 diabetes. So every morning I get up and look in the mirror and I ask myself, Woody, are you going to behave yourself? Or are you going to misbehave? Because I know what I'm supposed to do. I can't always do what I'm supposed to do. But there's two things that I have to do behaviorally, and that's watch what I eat and move my body around. So I just want to say, for me, parity is about making no distinction whatsoever between whatever we mean by physical health and whatever we mean by mental health. So I just felt like I wanted to get that out there.
Thank you.
If there's time, I can tell other stories, but I don't want to go off on these stories. But I've also had very complicated mental health issues, and I've had to put myself in counseling. I can talk about that. But the bottom line for me is, if I'm not on top of my blood sugars, then my emotional well-being, my mood is profoundly affected. So that's just one way I think about this issue of parity. I'll say quite simply about the paradox that you asked about.
Yes.
I mean, it pains me to say it, but I feel that the way I want to address that issue is, I'm very thankful we have the technology that will allow us to film all this stuff that is incredibly painful to watch, but the stuff that we know has been going on, forever. So I'm not in favor of vicarious racism and trauma, because I understand, witnessing it is the thing that's painful. But this issue we're dealing with, racism, is extremely uncomfortable. Just to say that word, we used to call it the R word. In the academia, there was a time when we were just really strongly discouraged from having this kind of conversation.
Mm-hmm.
Sometimes I have to pinch myself and say, am I really getting up in front of people and saying racism out loud? Oh, wait, I'm actually saying systemic racism out loud in a mixed audience. So anyway, I think the paradox is not so paradoxical for me. I think we need to get the phones out and film whatever is going on.
Thank you. Thanks, Woody. Dr. Dave Vines?
I definitely think that there's a paradox. I agree with Woody. One of the things I would say is that when we think about this issue of vicarious racism, and we think about people coming to counseling, the notion that this is a new phenomena is not true. That this is deeply rooted in history, and we need to take that into consideration in terms of how we frame Black psychological functioning. Because when we go back to the roots, like the 18th, 19th century, and we look at early psychiatry, we see that we see that early scientists did a good job of sort of sorting out plants and animals, and then people had this idea, well, maybe we should sort out people. And as people sort out people, of course, as Woody said, African Americans sort of fall to the bottom. When we look at how psychiatry was framed early on, Black people were seen as unevolved. Black people were seen as barbaric. Black people were seen in every negative light, and white people were seen as superior. And that shaped how early psychiatry was framed and how our current day counseling sort of works. When we look at the early facilities, we see that, sort of the notion of curing mental illness was sort of rooted in sort of idyllic treatment. If we put people in a psychiatric facility, they should have opportunities for music and the arts. And that was the case for whites. It wasn't the case for blacks. What was seen as necessary for blacks was occupational therapy, so that many of there could be the enforcement of this social stratification once people left. And so across the board, we see the past as sort of informing the present in very problematic ways. The way Black people were treated and sort of condemned and dehumanized still continues today when we think about many of the things that are going on.
Yeah, the threading in the report that you actually shared, one of the hospitals in terms of the Black experience, where you have someone, a Black man in a facility, he would then be his work would be out in the yard in terms of keeping the grounds.
So one of the things we found in doing the research is that, so the white women were sort of seamstresses, Black women were washing clothes. If, you all have grandmothers or maybe parents that use those scrub boards, washing clothes for a whole facility probably wasn't easy. There wasn't Maytag, there wasn't General Electric, there wasn't LG, Samsung. White men were gardeners. Black men, sort of worked in the trenches. A lot of these facilities had farms on them, and so Black men did a lot of the sort of the laborious work. In St. Elizabeth's Hospital here in D.C., when they got ready in 1877 to refurbish the hospital, they allocated $1,500 per white patient, $250 per Black patient. The white facility was built of brick. The Black facility was built of wood. And so we're seeing how a lot of this, sort of continues today. Slaves in the 1850s who were committed were hired out to work. And so when we think about the prison industrial complex, we see sort of parallels. Other thing I will say, and then I'll sort of turn it over. When we talk about things like the prison industrial complex, after slavery, there was a reduction in the number of Black men that were in a lot of these psychiatric facilities, and they were moved not out to work, but they were moved into prison facilities. And so we see the convict leasing system, we see the chain gangs, and we see the profit, the whole notion of profit. The last thing I will say is that many people thought that freeing Black people would cause insanity. And again, today we see people sort of situating the problems in Black people and not the systems that operate. So freeing Black people didn't cause insanity, but freeing people with no food, no housing, no clothing, no opportunities for work, that is what sort of created a lot of problems. In the same way, when we think about COVID, Black people weren't responsible for COVID, but the circumstances, the systemic and socio-political circumstances within which they find themselves sort of shapes some of these outcomes. So we see parallels. We could draw pretty much a straight line between the past and the present.
Yes. And it also goes to the treatment current day from the standpoint of us treating the symptom versus getting to the root cause, which goes back to what you were saying earlier, Dr. Akbar. And thank you, Dr. Norma Vines, for really taking us through that. Don't lose what she said. Okay, we're moving pretty quickly, but don't lose what she said about a number of things, and also the disparity in terms of $1,500 versus $250. There's a lot of really good factoids in that report, and this is not managing by emotion, this is managing by fact. So that's what this is all about. It's a qualitative and quantitative report. Ashley, did you want to comment on this?
Sure, I'll be brief, but the thing that sticks out to me is the quote from Darnella Frazier that you'll read in the report that says, if I didn't record the video, the world wouldn't have known the truth and they wouldn't have believed me. And so there is a necessity for recording these videos, but it has to be under the lens of equity. It cannot be for personal gain or personal recognition. It has to be to push this conversation forward, to use this as evidence. And it's also just very discouraging that Black people have to lay down their humanity in order to be believed, in order to be advocated for, in order to be seen. And it has to be through constantly providing these videos. And just think about the fact that she was 17 I'm 33. I don't know if I could have stood there myself, taken out my phone and recorded this video. And to think about the way that we kind of wrote it in the report is that, police officers hold all this power over us. They were exerting their power forcibly over George Floyd. But on the sidelines was a 17-year-old using her own power to take out her phone and to record this injustice happening. And so one of the things that I wanted to highlight in the report was that the world was watching now because of this particular video.
Thank you, Ashley. Thank you very much. And I would also offer the question of what was it like before technology when a black person said this happened to me, and society said, oh no, that did not happen, and that ripple effect of what happened to them in terms of their trauma, and they said, I know what happened, I lived it, but they didn't have the video, and were not believed and were minimized and misunderstood and discounted and maybe sometimes arrested. So let's go to the last question here. What happens in therapy if mental health professionals are not equipped to address a client's experience with vicarious racism with cultural humility? What happens if mental health professionals are not equipped to address a client's experience with vicarious racism?
Since I mentioned my own experience earlier, I'll just give you a quick response to that. I can tell you what happens. If you're a black person who decides you want to get into therapy because you need some help or you're trying to work stuff out, whatever, and you get a white therapist, you know what happens? They avoid the issue. They avoid the fundamental issue. I mean, I've had white therapists, I've had black therapists. Not one white therapist I ever had asked me about race. So this is a big problem. If you ask me, where do all your issues stem from? Your anxieties, your weirdness, your peculiarities, where do they come from? My answer is they come primarily from the fact that I was born in 1953, and I was one of the first to participate in this crazy experiment called racial integration. I had to go to school with white people and deal with everything I had to deal with. And, I won't go into that story, but you get my point.
Mm-hmm.
These are the kinds of things that we need to talk about in counseling, in therapy, and, that's what I think about. It's the avoidance of the main issue that is a problem. It's probably a reason why a lot of us just don't go. We don't think we're going to get what we need.
Thank you.
And I would just add one of the consequences of not being able to talk about issues related to race and representation in the counseling arena is the underutilization of counseling services, premature dropout, cultural concealment. So when people don't feel like they're being heard and understood, they stop talking about aspects of their culture. They don't come back. We looked at a study for the report that showed that in a survey of about 2,000 clients, ethnic minority clients, 80% of them had experienced some kind of microaggression. Now we know that counseling is a microcosm of society, but a client should not come into counseling and be doubly wounded out in the world, and then come into the counseling dyad and have some kind of negative experience that sort of further traumatizes them.
Thank you very much. Ashley, your thoughts?
Ditto.
What happens in
Right.
therapy if mental health professionals are not equipped to address a client's experience with vicarious racism?
Honestly, I think it really is a barrier for all of us. It does not serve either the client or the therapist to not talk about these issues that are so deeply connected to our race. And so it's important for us to have companies like Hurdle that are trying to address those issues by training therapists to be culturally competent so that we don't continue to make those same mistakes. And that, Hurdle is really kind of standing in the gap and trying to be a bridge between what, clients need to provide a service and also what we're doing as a research team to kind of add to the body of literature that does not talk about the needs of Black people. So I think that's where we are, and that's one of the things that's hopeful about the work that we're doing.
I didn't know whether you knew that you were teeing up the last question with the word hope. But here's the final question as we get to the wrap up, and let me apologize to the audience in terms of if we aren't able to get to any questions. But the last question is, what gives you hope for a brighter future? And I want to ask everyone that. What gives you hope? Ashley, why don't you kick it off, because you were talking about hope just now.
So what gives me hope has always been that, there is this work to be done, and that there are so many of us and so many of you who are in this room that have an invested interest in making sure that Black people get the type of support and care that they need. And also thinking about companies like Hurdle, whose mission is not just to make money, to be a service, but to actually make progress towards mental health equity. And I also think about the youth, who are people like Darnella Frazier, who are afraid but unafraid at the same time of whatever the consequences might be by their actions. And if we are able to continue to support them and to nurture them, that we could see a real change in the type of world, the legacy, as you mentioned, that we want to leave behind.
Thank you, Ashley. Woody, and Dr. Norma Vines will go last. We'll give her the last word.
Yeah, so I already, tipped my hand a little bit. What gives me hope is the fact that we're actually talking about this issue, but I want to maybe go a little deeper into that. So I misspoke earlier. I was not part of the experiment of integration. I was participating in experiment of educational desegregation. So in other words, I lived in an all-Black neighborhood, so segregation was there. But because our Black neighborhood was surrounded by predominantly white neighborhoods, the schools were integrated. So, my issue was living in a Black neighborhood where it was understood you could not trust white people. And then, Woody, by the way, you're going to school with white people. So I'm in the second grade, like, okay, how do I negotiate this? Long story short, what I discovered over the years was that I kept my relationships with my white classmates superficial. I was just trying to get through the school day with no drama so I could get back home to the all-Black neighborhood where I felt comfortable. That made sense for me as a coping device, but it's not really going to help us solve this issue if we keep treating each other superficially across this ridiculous color line. So what gives me hope is that in my life right now, there's actually a broader conversation happening. And it's going both ways. So some of my white friends are actually now coming to me, with legitimate questions. But here's the thing that I can't quite believe. I'm actually going to my white friends and saying, okay, look, no more of this superficial BS. We're going to talk for real. I need to know, and I know I might not want to hear what you have to tell me, but we need to figure this out. We live in the same neighborhood, but can we just stop always talking about the weather, sports, our grandchildren? I mean, decades of superficial conversation. So what gives me hope for the future is that I think some of that is starting to break down, and we're trying to be honest and transparent with each other across race.
Thank you, Woody.
My hope and appreciation is the visionary leadership of Kevin to sort of have this whole idea and not just talk about it, but put it into practice and bring clinicians together. I mean, just a whole team from sort of various disciplines to come together and sort of bring this to fruition. and have the space where people can really come home psychologically. They can talk about what, as we say in the African American community, some of us, what had happened was. and that is really important, and that what had happened is important to healing, and to be able to talk about it without being judged for the discourse style that you use, judged for where you grew up, judged for any number of things becomes important. And Kevin is giving us a platform for that.
Thank you very much. And what had happened was we are at the top of the hour, and I would tell you that in me answering that question, what gives me hope is all of you all here, all that are listening to us, and our subject matter experts in the partnership, the Kennedy Satcher Center for Mental Health Equity, the American Psychological Association, our representative, Sheila Mccormack, her leadership, and all of us having the conversation and taking it deeper and wider, and being vulnerable, because there's strength in vulnerability, but also in execution, leadership, tone, and execution. What are we going to do differently? How can we challenge ourselves? And I think that we're all prepared to do that. It gives me real hope about the collective, and collaboration, and appreciate all of you all being here. And I have a lot of hope, we all have a lot of hope that we will be here together again next year, because last year this was virtual. So let's keep the hope alive that we will be able to be together again next year, and we will have moved the needle. So we wish you all the very best, the balance of your day, and to Hurdle and to Kevin and his team, thank you for an outstanding report, outstanding work, and your leadership. And we wish everyone the very best on your day. Thank you very much.